Hi and welcome to Healthy Living. We are here today with Kelly Presnell, Director of Marketing and PR for Hilton Head Hospital. We have a fantastic show.
Yeah, I'm happy to introduce Dr. Brian Buckley. He's internal medicine, one of our new physicians in the community. We are always looking for primary care physicians to serve the community, internal medicine and family medicine, but he is particular in internal medicine, which is great to serve our community. There's so many active adults that need a physician. We're meeting the need. He's going to be out in our new Bluffton Medical Campus, and he's excited to be here. He moved from Virginia, and we're thrilled to have him.
And I'm excited to talk to him too. I think as we get older, having an internal medicine doc is really important for all of us. So let's talk to Dr. Buckley.
Dr. Joyner. Dr. Joyner,
When you're sick and need to go to the ER, it's no fun to wait. There is a smarter way. Check in online at HiltonHeadRegional.com and skip the ER waiting room. Hilton Head Hospital, the smarter way to ER.
Pain. It can be different things for different people. A shoulder that takes you out of the game. A knee that stops you in your tracks. Ready to return to a better you? Hilton Head Hospital is here, right in the Low Country, to help heal what hurts. From diagnosis to treatment to full recovery, our fellowship-trained orthopedic specialists are committed to getting you back to your best. Hilton Head Hospital. Extraordinary care right here at home.
We are back here on Healthy Living. We're talking today with Dr. Brian Buckley. Thank you so much for joining us. And we've had a ball kind of chatting before the cameras started rolling. And I must say you share a fascinating background. If you could enlighten us a teeny bit with what you used to do and where you are now and your background.
Well, originally I'm from Southern California. Went to school at University of California, Davis, undergraduate, and during my junior year, I was drafted by the California Angels.
Oh my gosh, that's kind of cool.
So since I was a young boy, I always wanted to be a baseball player. But so I signed, and I played 6 years of minor league ball.
Oh, did you really?
And I would go to the school in the off season. I continued. I must admit that minor league baseball, I was probably one of two people on the bus that read books during this time. So,
what position did you play during that time?
I was a pitcher.
Okay.
And I had a little bit of success. And then I had an elbow injury and it curtailed things. So after that, I went to medical school.
Did you know that you had always wanted to be a physician? Is there... are there other physicians in your family?
There are, but not close.
Okay.
Not really. I was interested in physiology in university, and I studied human physiology. And most of my classmates, they all went on to medical school. It wasn't a burning goal always, but. I had the degree, and you know, I decided that we'd give it a go.
And you loved it?
I do, yeah, very much.
Where
so.
did you do your medical school training?
At Georgetown.
Okay, and then?
And then my residency, I went back out to Arizona in Phoenix, St. Joseph Medical Center, which is affiliated with the University of Arizona, and it was, you know, it was a spring training site. I had been there before, and I knew the area. And, you know, there was a need, I could tell. That things didn't work out in Arizona, though.
All right. When you first decided to be a physician, did you have an idea of what kind of physician you wanted to be?
Not exactly. I was a little bit older in my class. And
Seasoned.
well, no, actually, age-wise.
Oh,
I went to
I was
medical
giving you a break there.
I was one of the older students, and
Let me reframe that then. You were wiser.
well,
Okay, fine, you were older. Go
I don't
ahead.
know. Well, we used to do hospital rounds, and the attending doctor would come in, and he would address me like I was the senior resident, and I was a medical student, you know. So, but I was older, and you know, the internal medicine, cardiologists, gastroenterologists, endocrinologists, they're all internal medicine doctors.
Correct.
And they do a fellowship and a specialty, and being a little bit older, I had a young family, and I really enjoyed internal medicine, so I just stuck with
that.
general internal medicine.
Can you talk to me a bit about what internal medicine really is? I think for many people it's this kind of oblique word that we're not really clear about.
Yeah, I would agree that a lot of people, it's not common knowledge what an internal medicine doctor. Simply, it's really an adult physician. It's the training is different than family practice per se, where they do a little bit of OB, they do some gynecology, they do a little bit of surgery. Internal medicine training is really, you know, heart disease, lung disease, diabetes, all these things that come along with adults and aging, preventative things.
Well, yeah, let me ask you a quick question. At what age do I encourage my children? At 60, I'm already in with you. So at what time do I encourage, at what age do I encourage my kids to go to an internal medicine doc? Is that 18, 21?
Yeah. You know, there's no set rule.
Okay.
You know, it's nice to have your own doctor.
Yes.
You don't want to meet your doctor when you're ill.
Correct.
You want to have a doctor that knows your history, and then if you're ill or something's changing and you don't know what it is, that's the place to go.
Yeah, I have a relationship with you so that you basically know me at my best, have baselines for everything.
Correct. And, you know, generally, anybody over 40 should have an internist.
Okay.
Now, this is my opinion. And just that we monitor, we encourage behavior modification for lifestyle, and we try to early detection or prevention of things.
Has your practice changed from that of treating disease to working more from a prevention model? Because I've heard you say prevention twice.
Yeah. The last couple years, it was all prevention.
Oh, interesting.
With the new guidelines, like the new Heart Association guidelines, they are based on risk factors that unless you have a doctor, how are you going to know what those risk factors are?
And what are those risk factors?
Well,
now that I've got you captive, because then we will know.
Well, it came out the last 48 hours. You know, it was regarding cholesterol treatment. We used to, the old guidelines were based on absolute numbers of LDL
versus HDL.
Right. Now it's, if you're a type 1 or type 2 diabetic, you should be on
statin.
A statin, correct. If there's any history of heart disease, this is a calculator, if your risk in the next 10 years is greater than 7.5% of having heart disease, you should be on there. And how would you know this?
Yeah, you wouldn't know that. Well, let me ask you just a broad spectrum question then, if I can. I come to the internist with expectations of, are we doing a physical, are you doing, obviously, a very comprehensive health history that includes, because I heard you say behavioral modification too, kind of a biopsychosocial history?
A complete history. You know, much more than you'd have if you were having a knee surgery.
Right,
They'd be
exactly.
worried about anesthetic reactions and bleeding problem. But an entire, your family history would be included. And, you know, these things all put you at risk factors for certain diseases, and these should be screened and monitored.
All right, so as a patient, I come to you, and are you at that point, and I don't know what the right word is, you basically are my doc that I go to once a year if I am ill? It's not just to establish a baseline, you basically help me kind of navigate the system too.
Correct. And, you know, the primary care, which is really an insurance term, but it is to help navigate the system. But you know, it would be very helpful to both patient and doctor to establish a relationship that's not when you're ill, not when there's a crisis situation or something. And then when something comes up,
Okay.
then it's my job to help direct you with counseling, referrals to the proper treatment.
What do you need from me when I come in the first time? How can I be a proactive consumer and patient and give you and offer you the best information so that then you can be the best diagnostician for me?
Yeah, that's a good question. I mean, the more health history that you know, family health history that you know,
Okay.
is good. You know, all your medications or medications that you had taken. You know, there are subtle things that all happen with humans as we age, and sometimes we're not aware of them, but a spouse or a child may say, "Mom, you're forgetting your keys more," you're, you know, something.
You seem like you're slowing down, you're walking this way rather
you
than...
don't see as stable, you know, you don't see him as happy as you
Oh, good
normally.
point.
These things are, should be looked for. You know.
And I like what you said, they're very subtle, but they can be pretty, have a tremendous impact on quality of life. We're going to take a quick break, Dr. Buckley. We're going to come back. What I'd love to do when we come back is talk about some specific diseases that are adult-related that you will treat in your practice, especially down here. So stay with us. We'll be right back here on Healthy Living.
Pain. It can be different things for different people. A shoulder that takes you out of the game. A knee that stops you in your tracks. Ready to return to a better you? Hilton Head Hospital is here, right in the Lowcountry, to help heal what hurts. From diagnosis to treatment to full recovery, our fellowship-trained orthopedic specialists are committed to getting you back to your best. Hilton Head Hospital. Extraordinary care right here at home.
Hilton Head Regional Medical Center is located at 25 Hospital Center Boulevard. When traveling east on William Hilton Parkway, make a left-hand turn on Beach City Road, and the next left, Hospital Center Boulevard will be located just past the Hilton Head Library.
Coastal Carolina Hospital is located on US 278 at Exit 8 on I-95. Telephone is 843-784-8000. On the web, www.coastalhospital.com.
The vision for Hilton Head Spine Center is very clear. It's to provide world-class spine care to our patients. Physical therapists were there. They were there holding you up.
it's nice.
I just love working with all of these patients and their families and getting to know them and helping them on their journey.
My life is definitely better, and I'm glad that I came here at Hilton Head Hospital.
We are back here on Healthy Living. We're talking today with Dr. Brian Buckley, and we're talking about internal medicine. We talked a bit about how to be a good patient. And it's funny because, again, we were talking about what makes a good physician, what makes a good internist. And you said something that was pretty powerful, and that was about part of what you do as a physician is listening. Can you share with us a little bit about your role as the physician?
I mean, nobody's going to come in and say, I've got a cholesterol problem, or I have high blood pressure, or I have pancreatitis.
True.
You have to establish some kind of rapport with the patient, and then listen to what they want to tell you, and then gently guide them so you get a fuller picture to try to just get a history.
Is that the fascinating part, one of the fascinating things that you do?
The best part of my job.
Okay. Look at you, you got
to. Well, it's true. Is that you get to know individuals at a certain level that you would never know. You know, you pass them in the street, but you get to intimately know people, and that's a privilege, very much so. And that's the best part. The worst part is the paperwork and insurance.
Oh yeah, well that's just the yuck, yuck, yuck. Do people who come to an internal medicine, then you are considered, if you will, like you said, your primary care physician at that point in time for adults. What are some of the diseases that are specific to adults that you see within the demographic here? I mean, I would have to imagine that diabetes would be something that would be fairly prevalent.
Yes. Diabetes, hypertension, high blood pressure, cholesterol issues, overweight, smoking, things like that. You know, they're all part of the same thing. They're all part of heart disease and vascular disease.
Are your patients part of the decision-making process when it comes to their treatment? Because I can't imagine that I come in as your patient in a vacuum with my health. In other words, I would say rarely would you say, oh, you know, there's this one little specific thing we have to work on. I would think there would be more of a...
No, it's much better as a general overall plan or package to look at things. And, you know, staying active, there's some simple guidelines. Staying active, being mentally active is really important. Just some suggestions from me, you know, health-wise. You know, there's lots of information now with the internet. And
True.
And, you know, every newspaper has a health section, and, you know, they actually get the results from studies and journals before the doctors do. The newspapers, they'll actually have an article about something, and I've often been approached by patients, they want to know about this.
You're like, yeah, exactly.
I haven't heard about that one yet.
Two questions. Are most of us truthful when we give our histories to you, number one? And number two, do you have opinions about the sources that you go to on the internet? And the reason I say that is I work a lot with adolescents, and Wikipedia is like their source, and I'm like, oh, no, you know. But I think many of us, you know, would Google diabetes and not know what was a credible source or not.
Yeah.
Just asking here.
Yeah, that's fine. Let me give you an example of what goes on with humans. We're all human. You know, in medical school, when we learn about certain diseases, about half the medical students have to diagnose themselves.
Oh, okay, no doubt.
Right? and you know that, oh, I must have this and I must have that, and so it's difficult to just rely on symptoms and things that you read on the internet. You know, really, if you have these suspicions, you should go see your doctor.
Okay.
And talk about it. Have an honest discussion with it, and generally, you know, they can be either ruled in or out fairly easily.
Fear, shame, embarrassment, do all of those?
Yes, I have all those.
As do I.
At certain times.
I think we all do. But again, you talk about part of the privilege of what you do is really having that kind of relationship with your patient, because that's just the nature of the being.
Yeah, it is. And the more comfortable you feel talking to your doctor, you'll be more honest. And he'll be, or she will be, a better doctor to you.
Do you have a guideline for people? Again, we talked about being an informed patient when you come in. Are there things that I need to pay attention to? And I'll give you just the things that are coming at me as I'm thinking. You know, you're going to ask me, am I a healthy eater? Do I exercise? I'm imagining those kinds of questions.
And, you know, any past medical history.
Yeah, we talked a bit about that.
You know, any prior surgeries, what medication. There's things that run in the family. You know, often bring up depression or mental health issues because just to have an idea.
At what point does an internist then say, okay, this person has chronic bronchitis and we've been treating it. It may look like, I mean, is that something that you treat? At what point do you turn things over to someone who would specialize?
Yeah.
If it's cancer or whatever?
Good question. Oh, yes. Cancer, definitely, for definitive treatment. But most of the groundwork is done by the internist.
Yes.
You know, certainly if they're not responding normally to treatment, you know, or the reoccurrence, we talked about bronchitis, if you know, maybe there's an allergic factor or maybe there's something else going on that would prompt you know, a suggestion for a referral by me. You know, lots of times patients come in and say, I want to go see this doctor, and that's fine, but it's kind of ignoring what internists do.
Well, and because I guess I can say it. I think my dad's a cardiologist in internal medicine, so I sort of grew up with the internal medicine practice. Literally, patients coming in at 21 and he's 86, and so, you know, the majority of his patients now are like 100, right? But I mean, seeing them from all the way through getting married, all the way through their lifespan.
There's a spectrum, and you know, it's your risk factors for things are gonna change. You know, if you can modify your behavior at 40, you can avoid things at 60.
And the science of internal medicine, but the art of internal medicine, I can't help but think, if you know who I am and know me, because we've developed a relationship with you as my physician, that, like you said, subtle things that may be occurring, you're going to pick up on more quickly than I am, because you've kind of got this baseline, if you will.
Well, that may be a little presumptuous, but that would be a goal. You know, I've had long-term patients that they walk in the door, and I know
something's different.
Something's wrong, and so I will pursue that just based on what I observe.
Are you finding that heart disease, which I still understand is one of the most significant things that you treat, are
try to modify the risk factors.
Yes, okay.
And you know, hypertension, lipid problems, diabetes, smoking, overweight, You know, they're all windows into the same thing.
Well, let me ask a basic question. When do I come to you? Do I come to you once a year for a physical? Do I come to you when I have a cold, a cough, or the crud?
My preference
Okay.
is that you come at least once a year.
Okay, once a year.
And then, therefore, when you become ill, you know, it's really my job to be able to see you whenever, you know, whenever you're ill or there's a change in something.
Okay.
In a life event, in, you know,
Everything.
Anything, yeah. Or a place to go where you don't know where to go. You know, not expected to be able to diagnose yourself through the internet, looking in the mirror.
I love it. Dr. Buckley, thank you so much for joining us today. We want to thank all of you for joining us here on Healthy Living. Have a great week. Bye-bye.